Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Okay, no matter where you are, welcome to our program. We're so grateful that you could devote some time to talking with us or listening to us in this respect. Unfortunately, our Vein show is not done live, so you can't participate, but you can always send us an email, and we'll tell you how to do that later. And we're going to refer you to the 4 different office locations of Vein Clinics of Hawaii, the Big Island, Kauai, Maui, and, of course, here where we record on the island of Oahu. And today, in this show, we're going to do something a little bit different. It's the first time we've done this, as a matter of fact. I've made reference a few times to some of the things that go on at Vein Clinics of Hawaii that you didn't expect. There's some things that are really fun, and today's topic is going to be that. You know, we're all pretty vain, and here in Hawaii, we like to go outside, show ourselves off. There's lots and lots of ways you can do that. Some of them involve procedures, and that's kind of what we're going to talk about today. Is that pretty good?
That's good.
Yeah, okay. I just want to make sure because, you know, if people listen to the show and everybody that does, they know that sometimes we deal with stuff that's painful and sometimes we deal with stuff that's actually threatening, you know, it can turn into something terrible. Today, everything we're going to talk about today makes you feel good.
Yeah. Much of what we do at Vein Clinics of Hawaii is medically necessary.
Sure.
People don't necessarily want to have to go through some of the procedures they go to. Many of them do. But some of them are a little more difficult if they have advanced venous kind of disease. The other side or the other half of our practice is doing fun things that people want to come in, maybe, improve their appearance, help their self-esteem. That's a huge part of it.
Especially here. We're outdoor folks, and we don't. It's not like people that work half the year in Alaska. You don't see anybody's legs. It's too cold.
Right. Right.
But what I'm getting at is what I think is interesting to me anyway. And if you've been listening to the program, you know that we touch on some pretty important stuff, and a lot of it is to do with our ability to work and play and do things because of pain and discomfort that can be alleviated. And I'm guessing that a lot of what we're going to talk about today. Particularly with spider veins, which aren't usually painful, but they are maybe mentally painful. And maybe somebody, once they've had, spider veins done, they say, well, my leg is sore. And, is there something else we can do? So in other words, some of it might be fun, but later on you might be realizing, hey, I didn't even realize until I did the fun part that there are other things that I need to look at.
Right, yeah, because some of those things can be signs of other medical issues, and we're alerted to those and make sure that the patient doesn't have it.
Okay, so when we talk, and I know we're going to talk about a bunch of stuff, some of which I'm a little bit up to speed on because I've been there, but some of it's going to be new, and you're going to also meet somebody from Dr. Juliff's practice in just a minute, and we're going to talk about that. But you mentioned spider veins. If somebody has spider veins, do they necessarily have deep vein problems as well, and vice versa?
Not necessarily. Mm-hmm. It's probably half and half. Some people, a lot of people have spider veins.
Sure.
And a good percentage of those people also have underlying, vein functional problems, something that we call venous insufficiency. Spider veins can be just one of the signs or symptoms of a bigger problem, the same way that varicose veins are, but not as frequently. Mm-hmm. People who come in with varicose veins, inevitably we find venous insufficiency of one sort or another. But sometimes people with spider veins, it is purely cosmetic, has nothing to do with vein function. And we take care of that too.
Okay, in the big world, everybody wants to know. The 4 words that we always hear in Hawaii are, how much is it? How much is it, I call it. And I do know that there's some procedures that are elective and some are cosmetic. Are we talking today mostly about cosmetic things?
Today we are going to talk mainly about cosmetic.
Good, that's going to be fun.
Yeah.
It doesn't hurt, but it makes you feel good. Well, maybe some of it does hurt. But we've often said a few things. Dr. Juliff's practice, Vein Clinics of Hawaii, started on the Big Island and has grown to be now 4 islands wide. And one of the things that I learned when we first started talking, Doc, was that you wouldn't be able to open your other facilities, nor maintain them, nor keep them if it weren't for your people. So let's talk about that a little bit, and let's introduce our special guest for today.
Yes. Well, Carly,
Okay. But
yeah.
I mean, but what I'm saying is that, it's like we've had patients come in here who rave about your folks. Mm-hmm. And you've often said you couldn't maintain your offices if it weren't for
absolutely.
the other folks.
Yeah, since we do have several offices, I can't be everywhere all the time. And there are 2 other providers in our practice, but so none of us can be everywhere all the time. So we rely very, very heavily on our employees and people to run the office when we're not there.
Okay, here comes Carly.
Yeah,
Carly is we found out for a service wife, right?
Yeah.
And like many people here, had you been to Hawaii before you and your husband ended up here when he was deployed?
Never. I didn't even know what island we were moving to.
Is that
honestly.
right? Yeah.
No.
How long ago was that? How long you been here?
We've been here for about 3 years.
Okay.
Yeah.
And where did you come from, and where was your schooling?
So I was born and raised in Pennsylvania, near Erie. I'm not Amish. A lot of people ask me that here.
Did you have a clippity-clop, a rig? Well, just like when you got here, you probably thought you were going to see some hula girls and grass shacks, too.
Oh, definitely.
Yeah, of course.
Yeah, I expected to be, get the lei.
The Mai Tai and all that stuff. Sure,
of course.
Yeah.
And then I did my schooling at Edinburgh University. It's a state school in Pennsylvania.
Wow.
Yep.
And why the calling in that area? What was, when you said you did schooling, what did you want to do?
Well, actually, originally I had applied to school to be a nurse, and then I switched my major at the last minute to art education. I did that for about a year, and then I had a personal incident that happened in my life. Someone very close to me had an emergency, and just seeing people take care of that person, it struck a chord, I guess, and it motivated me to go change my major again back to nursing. So.
That's pretty cool, Doc. When and I guess that you find out with your folks all the time. But what I think is even neater, when people come into an office, they have no idea what your background is. You're doing what you're doing, but obviously you must have taken to make that change and decide that. You must have said, "Hey, wait a minute, I'm going to make a bigger commitment here."
Yeah.
Is it what it was cracked up to be? Are you happy doing what you're doing?
I think so. Yeah. Especially working at the clinic now. I used to work in an emergency room, and the personal relationship with my patients was different. Now, we see the same patients all the time, and we have a really close, I feel like my patients are part of my family. So it's rewarding to see the positive changes that we've made in their lives.
Yeah, that's really cool. And you're right. And Doc, we've talked about emergency room stuff before. And I mean, you get people that are like, really, they're hurt. They're at wit's end. And what you're doing a lot of times is saving a life, not just making them look better. You're getting them back off the chair.
Well, the big difference between that, where in the situation that Carly used to work, in the situation that I used to work.
Sure.
When we were doing surgery and except taking care of patients in the ER, those patients didn't really want to be there. They didn't choose to go to the ER.
You meet everybody on a gurney instead of at a golf club or at a party, right?
Yeah. So, one of the very nice things about the type of practice that we have is that, by and large, pretty much all of our patients want to be there and have us, do what we can do to help them. It's tremendously rewarding because, we see a whole host of different problems and different types of patients that really we do make a difference in their life. It's
absolutely,
nice.
And we've chronicalized that a lot, and we're going to continue to do so. That's why we love it when patients come in. But today's a little bit different, I should say, because maybe people would want to know. All right, well, that's nice. Who knew? They're going to vein clinics of Hawaii. When they get there, they're referred by their physician, or they get there and they're waiting while their husband or their wife gets treatment. They look around and say, hey, there's a lot of other stuff going on here. Like what?
Yeah. Well, a few years ago, I kind of made the decision and the commitment to bring more aesthetic type opportunities for our patients. The reason for that was that a good part of our practice, our vein practice, has to do with aesthetics.
Sure.
Probably the largest part is considered medically necessary, but kind of the icing on the cake is to not only treat the patient's underlying vein, functional vein problems, but to have them leave the office ultimately with nicer looking legs. And I think that most people, no matter what stage of, venous disease they're in, they want that to happen. And certainly many, many people want their legs to look better.
Okay, what we're talking about today, if you've been with us before, we know about the 6 stages of venous disease. Today's stage 1.
Yeah.
Most, if you have different than that, go to the website, veinclinicsofhawaii.com. Do want to click and we'll take care of you. But today, we're going to back it up a little bit, not just to have a little fun, but I think that the one result is on your main venous surgery is pain, lifestyle, ability to go to work, ability to walk. And this one here is, in many respects, I'm thinking the same thing. Willing to go back to the beach again, willing to go and watch a kid's football game and know you can sit there without being, your legs looking funny and all of that.
Yeah.
So that's why it's kind of neat, Carly, that you're here, because you've had both sides of this. I mean, you go from the ER to where somebody just wants to look pretty. But in a lot of respects, don't they come to you for the same reason initially, to say, okay, is it going to hurt? What are we doing here and all that stuff?
Oh, definitely. Yeah. Anytime you walk in a doctor's office, you're not sure of what to expect. So in our office, I love that no matter what our patients are doing, whether it's venous care, aesthetic care, we keep the patients comfortable. I think that was when I was interviewing for the job. That was the first thing that Dr. Julev told me or left an impression on me, was we need to take care of our patients like they're our own. And so all of the services that we offer are comfortable, and patients walk out and they're happy. So
yeah, that's why it's a happy day. So that's what I'm getting at, Dr. Julev. When we talk about this, we're going to motivate some people today to just come and take a look. We're certainly going to point them at the website, and they can see that there are other things there besides emergency vein treatment.
Right.
But I'm still interested in the decisions that you made and what are the categories that you're able to offer. And do you see that? I guess it's like, look, if somebody comes in for a vein problem, they might also have an appearance thing that they want to deal with. Isn't it nice to be able to do it both in the same place?
Yeah. And that's just it. I mean, we were concerned about aesthetics for the legs, and that sort of just evolved into aesthetics for the rest of the body too. Carly, when she came on, she made a commitment to being involved in this, and has really done a very, very good job at taking over the program, organizing the aesthetic, opportunities that we have for patients, and that's why I wanted her to come today, so she could talk a little bit about that. And, one of the first things, I think that when patients come into the office, they probably aren't thinking, gee, I want this laser, or I want this light therapy. Yeah, they don't know that. Yeah. So they come in with complaints. And, one of the biggest complaints that people have, especially in Hawaii, is pigmentation problems of the skin. And a couple of the devices that we have are very good at that. And Carly has gotten very good at treating those things.
And they are, Carly? Talk about some of them.
Okay, so I guess the easiest way to talk about it is we do have 2 different lasers on our Oahu facility, in our Oahu facility. And they're manufactured through Cynosure, but they're called the Icon laser and also the Picosure laser. Both the treatment is directed towards, like Dr. Julev said, the pigmentation. A lot of patients also come in with something called melasma, which is like when you're pregnant, it's kind of like the pregnancy glow, but it never goes away.
Oh, okay.
And then it becomes troublesome later on in life. I always tell patients here, we can't escape the sun, unfortunately. So a lot of people who have grown up in Hawaii and lived here for a long time, it's inevitable for them to have some brown spots. Fortunately, the lasers that we do have, we use a numbing cream to allow the patients to be comfortable. And the treatment.
In other words, when you say it's going to hurt a little, it's going to be kind of a little. without the numbing thing, this might hurt a lot.
Yeah,
okay.
It may hurt a lot.
I want to know the pain level before I sit down. But one thing I want to interrupt. I want to ask you this. I know a lot of times there are other people in other areas and other practices and other offices that try these things. Mm-hmm. And sometimes they'll end up with a client or a patient that's unhappy. Mm-hmm. And I want to know if from time to time you'll get people that have tried something somewhere else and are, because of your reputation, coming to you and saying, can we fix this? I should have come here in the first place. Doc, I know that you hear that sometimes. Even with your Venus stuff, you hear it a lot.
Sure.
People have bad experiences sometimes.
Yeah, well, we try to stay on top of the technology, and we feel like education is important. So we hope that we're offering a good product.
Well, when you said a couple times, Carly, you mentioned laser, and I'm just flabbergasted because when I was a kid, nobody knew what a laser was. And today, we're finding out so many different applications for this thing. Certainly, it's been no secret that it's been in the eye care field for a long time. Laser surgery, laser this. So you talk, this is everyday stuff for you, right? But for your patients, what is this stuff? What maybe are some of their concerns? How do you explain how laser works to people?
Well, okay, so I guess what a lot of people are familiar with is lasering, like laser therapy, that is really invasive. So there's lasers out there that actually peel away the first layer of your skin.
Yikes.
The lasers that we have here, they're achieving similar results, but in a more conservative manner. But what the light energy actually does is it's attracted to color. So darker color is better almost. It also depends on the skin. Like the darker color in what we're treating is the most important thing, but the skin color, that can be a little tricky. However, it's targeting what's called melanocytes. So the melanocytes are under your first layer of your skin, and it helps to break those melanocytes up and give your face or any area of your body kind of a more uniform appearance.
Okay, just out of curiosity, because I want to touch upon this as we go along from time to time. I know from Dr. Juleff and me that more and more men are getting, surgery for aesthetic reasons, especially, veins if they're outside. Grandpa, what's that? I went through that, so that's why I had some stuff done. Are you finding men are curious about some of these things too?
Oh, definitely. Yeah. I guess for pigmentation, I've seen primarily women, but men are also, included in that population. Men come mostly for, we do have a laser that does scar revision. I've seen a few men come in with, they want to have some scar revision done on their face or any area of their body again. But yeah, I guess women come through the door and then they kind of drag their husbands along.
Yeah, I was going to say, I think, Doc, you've said that before too, especially when it comes time for spider veins and then the more appearing, other veins that need, venous insufficiency veins. But every now and again, a guy says, well, the thing's on the back of my leg. I don't see it. But then the wife says, well, everybody else does. Yeah. And they always ask me about it. So when are you going to get it fixed?
Yeah. They recommend highly that their husband comes in.
Yeah. Okay, but I still think that getting along, when people become, I guess in the first place, they're inquisitive, whether or not you have something that is going to make them feel better. So walk us through how you explain to a new patient what you do.
Well, it really just depends on what kind of goals they have. So, the lasers that we have specifically on Oahu, they treat, facial pigmentation, as we already went over. They treat vessels. We also do fine lines and wrinkles, laser hair removal. There's a number of treatments that we can offer.
These things. Let's not skip over them so quickly. Let's and once again, I know that in the old days, almost everybody said, this is just women. But I think that more and more procedures that are available, particularly if they don't involve a lot of pain, and they have such good results with all the new technologies, that a lot of men listeners are going to say, okay, I'm not going to tell anybody, but I'm going to go check it out. I want to see if I can do something for me.
Yeah.
Yeah, well, in addition to that, over the course of the past 10 years, people are spending much more money on non-invasive aesthetic, types of procedures. As opposed to having surgical procedures like facelifts and eyelids and all this sort of stuff. So, and we Carly touched on it. the lasers that we have are such that there is not a tremendous amount of downtime. It's not like you come in and have a laser procedure and you have to be, out of public for 2 weeks.
Yeah.
People go back to
all
work.
of them in the very beginning that way?
A lot of them were
yeah.
because especially early on, the lasers that were used for facial skin resurfacing, they were very, very aggressive, and not only was there a tremendous amount of downtime, but also the complications that could arise.
And this is why those of you that when we look at the venous side of the practice and those things that you've been told since we started the program that 90% of what you see in Dr. Juliff's office 30, 40 years ago wasn't available. I mean, the treatment is less invasive and more walk in, walk out. But this also, when Carly, you talked about wrinkles. You can't watch a TV show anymore without seeing somebody with some cream and everything else. So isn't the battle between hiding it and fixing it? In other words, do cream? Do you guys use creams?
No, we don't.
Yeah.
The lasers work.
But I like their commercials.
I think what happens is
it's unbelievable.
Yeah, it is unbelievable. And so
Yeah.
I think once somebody goes through this 3 or 4 week thing, they say, "Hey, wait a minute.
Yeah.
I want to go see somebody who can really fix these."
Yeah, and that's what it boils down to. All that topical stuff. It's not long lasting because it's not really doing anything for the skin itself, as opposed to laser therapy that really does change the anatomy of the skin. And that's what we're looking for. That's what creates the difference in the appearance of the skin. Is we're plumping it up and developing new molecules that are healthy, etc.
What must be fun, Carly? It must be fun because I want to say you have the power. You have it's like Star Wars. You've got the ray gun. You've got the thing, and yet I guess it's practice, and the more you've done this, the more you feel that it's really something that people are going to appreciate. That's what I'm trying to get at.
Yeah, I think like the more you kind of believe in it, like that this is going to be something that can be life-changing for them. And I did want to touch a little bit, on the fine lines and wrinkles that we do. The thing that I love about the laser that we have is that it's more of a natural approach. So, there's other products out there like Botox, fillers, which our office can it does offer as well, but it's the lasers kind of take what's natural in your body. Collagen is re-stimulated and it creates just more of a natural appearance, and I really like that we can offer that to patients because some people, they're afraid of needles or they're afraid of Botox. They don't want the chemicals in their body, and this is another alternative to that.
You know what? I'm guessing that every patient is different. I mean, we could probably talk about veins in the same conversation, but there are probably more similarities with varicose veins than there are with some of these other things. So at what point in time this is during the consulting and during the initial relationship with a new patient, how do you explain, okay, this is what you wanted. It may or may not work. You have to be very patient with these things. In other words, how quickly do some people see results? I'm imagining some are immediate.
Well, yeah, pretty quickly. But there's two different kind of patients. One comes in saying, "I want you to do something about this one thing here." So they have a very specific expectation. The other group of patients come in and they say, "What can you do for me?" Which is fine.
Check me out. What can you recommend?
Yeah, which is fine. I mean, we like that too because then we can do a whole host of things. But you have to manage expectations. I think that's what you were getting at.
I am. Yeah.
But we have a pretty good idea about where we can get people. And this applies to the aesthetics as well as to the vein problems. We have a pretty good idea just from experience where we can get people, and we're completely honest with them. We don't we don't try to sugarcoat anything.
But one thing I want to make sure of, because I'm really excited to move on. We're going to talk about some really other things like stretch marks and a bunch of other really cool things that everybody has. It seems that there are some. We've talked about how specialized you became in your own practice. You decided, I'm going to be a vein guy. There are specialists all over the place, including plastic surgeons and dermatologists.
Yeah,
and all of these people. And it looks like some of these things overlap.
Oh, they do. Yeah, there's no question about that. I mean, there's plenty of plastic surgeons and dermatologists and other physicians that do vein care.
Sure.
I'm a little biased. I think that it's better to have a surgeon doing vein care, but that's my own opinion. But yeah,
it's also mine because I that's what I do. And so if you want somebody to drive the bus, it should be a bus driver.
Yeah, sure.
Not just the guy. Oh, I think I can drive this. No. Mm-hmm. I want the guy that's done it over and over again.
Yeah.
But that's what I was getting at, and I guess maybe there's so many different people going through. First of all, weight management is way bigger than it used to be because we've become obese. And I do know that I want to talk about stretch marks because I know that you do a lot of that, and sometimes it's the pregnant lady that's no longer pregnant, has the baby, got stretch marks. But guys got stretch marks too. How do you deal with stretch marks?
Oh, definitely. So yeah, I mean, similar. It's very similar. All of our procedures are very similar to one another. So when I have a patient come in for stretch mark revision, or they're interested in that, the first thing I ask them is what's most important to you, because what's most important to them might not be what I see that I think needs to be treated. Yeah. And so, stretch marks are kind of hard because if they're white stretch marks on a darker skinned individual, the treatment is a little bit more gradual than if there's pigment in the actual stretch marks.
Ah, okay.
So yeah, it's going back to delivering a realistic expectation for the patients. But the nice thing about the stretch mark revision is it can pull the pigments, but also it creates this softening appearance. So yeah, I tell the patients, you may have stretch marks when your treatment is complete, but your skin is going to look a lot more soft and also,
it's probably not only going to look a little soft, it's going to be softer.
Yeah.
Yeah. I mean, but there's another thing. I think, Dr. Jill, I'm really concerned about this because I sometimes do some consulting, as you know, in weight loss clinics about people that are having the type of procedures that I've had. And one of the biggest concerns that everybody has, especially those that have gone up and down over a 20 or 30-year period with diets, gotten big, small, they got a lot of skin that's just hanging out. And that needs a plastic surgeon.
Yeah.
And so, but however, once that's done, now there's some aesthetic things that may or may not be done in a plastic surgeon's office, right?
Oh, absolutely. Yeah. Well, the patient that you described, they need surgical intervention. There's no question about that. But yeah, once that's complete, then, kind of fine-tuning how everything looks can absolutely be done non-invasively with aesthetic laser, sure.
That's why I guess, Carly, for you, it must be really cool to be here because, where you come from, 6 months of the year, people, you don't see any of them. They're just everybody's all bundled up with stuff. Oh, yeah. Has that made a difference? Because are most of the patients that you deal with like outdoorsy people?
Oh, definitely. Yeah. Even, in the vein world and aesthetic world, I'm flabbergasted at how many issues people present to me because it's just not relevant or it doesn't exist, I guess, to my eye, back where I'm from. So I've told Dr. Julov this many times, but I feel very grateful to have the opportunity to treat, these issues in Hawaii because this population really needs what we service. One of the worst things for skin is the sun.
Sure.
So, some of the worst skin in the world is where the sun shines a lot, and Hawaii is one of those places.
I gotta laugh because I think we mentioned this once before. Dr. Julov and I talk a lot about it, and we'll bring Carly into this conversation too. How many of us don't wear compression socks like we should? And a lot of my friend who was the dermatologist who retired a few years ago said, I've been telling people for 60 years to stay out of the sun, but they don't.
They don't listen.
So what's next? Yeah. What's next is kind of, you got to watch out.
Yeah. And on top of that, it's only been in the recent past, when I say that, I mean 20, 30 years, that everybody has been real concerned about, sunblock, for your skin. When I remember when I was a kid, we used to go out and get burnt to a crisp and blister and all this sort of stuff.
Rub coconut oil and to get darker.
Exactly. We used baby oil with iodine in it. So that was not good for our skin.
By the way, gang, here in Hawaii, everybody used the Manoi oil from Tahiti and put soy sauce in it.
Oh.
And I mean, and then what you're doing is you're going outside and cooking yourself. You're parboiling your body, right?
Yeah, exactly.
Okay, so that, and there's another thing, Carly, and that is it also, because Dr. Juliff and I have talked about this on the program many times. It's exciting to be in the field that he's in here because of the ethnicities and all of these different bodies and all of these different people and all of these different, lifespans and all of these kind of expectations. So that must be sort of fun for you too, because not everybody even looks the same coming in there or leaving.
Oh, definitely. And it creates somewhat of a challenge for me, which is as the provider, which is awesome because, I'm not seeing the same patient every single day. And I have to be a little bit, with some patients, I have to be conservative. With others, I can be a little bit more aggressive in my treatment. So definitely, I love the diversity here.
Doc, doesn't that mean that's the fastidious records that are kept so that when somebody revisits 6 months or a year later, that we can sort of say, well, this is exactly where you were the last time. And here's what's happened to you in the interim. Here's some of the things you better look at getting corrected.
Yeah, well, not only that, but also just keeping track of what we did to them.
Sure,
because, there's a variety of different parameters that we deal with when we're, treating people with lasers. And we keep track of the settings, the energy settings and the wavelengths and all that sort of stuff. And that's a tremendous benefit for us then treating them subsequently with further laser therapy. We keep pretty meticulous records. I wanted to touch on not only what we've already talked about, but we have a newer laser called a Pico laser.
In Hawaiian, that's belly button.
Is it?
Yeah, P-I-C-O, belly button,
right.
Pico.
And do you feel like you want to comment on that?
Yeah, what is that?
Well,
because when you said it, I thought that was the belly button laser.
yeah. So Pico actually, or the Picosure Laser actually treats pigmentation and it does tattoo removal. It also can treat fine lines and wrinkles and acne scarring.
Did you hear, Doc, how quickly she slipped over that tattoo removal? Because I've been told by even tattoo artists that one of the biggest ongoing opportunities in the profession is removal of tattoos, because 30 years after people get some of these things, number one, the ship has sailed and it's not looking so good. Number two, they're yeah. They want to get rid of them.
Yeah.
Yeah.
Oh, there's a lot of people out there that want tattoos.
So that's part of the opportunities people have with this Pico thing.
Yes, definitely. And the really nice thing about the Picosure laser, as opposed to the other lasers that we have, is it is more optimal for patients who have darker skin tone. And
here we are.
Here we are.
Yeah.
We can't escape the sun. Yeah. The locals are born a little bit with more pigment in their skin. So this is a great laser for them. And I'm glad that we implemented it into our practice because, like I was saying earlier, it's a little tricky with each patient that comes in. And this will kind of give us a little bit more room to treat a little bit more aggressively and have better outcomes with not better outcomes, but just outcomes with patients a little bit quicker.
Yeah, isn't it sort of neat, Doc, every now and again when you're able to exceed the expectations? You talked about when people have expectations and they don't quite get them, but every now and then they must be, holy smokes, I can't believe this one. Is there a comparison, when we talk about these lasers that Carly's talking about, are they different from the laser that you're using in surgery? Or are they the same laser that can be used for multiple things?
The laser that we use for vein treatment, it's still a laser. Now, laser is just light energy, and there's different wavelengths and a variety of different things. But they are all, each different type of laser is directed at a particular type of molecule. Carly kind of alluded to this before. That's called a chromophore. So we use one laser to hit pigment cells, molecules. We use another laser to hit blood cells, depending exactly on what we want it to do. That's the great thing about lasers, is it be very, very specific. Now, the thing about the Picosure is that, yes, it's a much safer laser, especially for a wide variety of skin types. The science behind the Picosure is a little different than standard laser. because of the fact that it's got a very, very short pulse.
Okay.
And that's important because the amount of energy that you're putting into somebody's skin. The other lasers depend a lot on heat production. And when
I've heard you say that. I get that.
When you produce heat, you are potentially damaging tissue that you don't want to damage.
Yeah, especially But when you do that in the vein, you're doing exactly what you want to do.
Exactly. But so the Picosure is very, 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 very short, and that's where the pico comes from. Mm-hmm. Pico means picosecond is like a millionth or whatever of a second. Very, very short. Yeah. And so it's not as much heat; it's more of a mechanical energy source that's hitting. For instance, if you're treating a tattoo, you're hitting those pigment molecules and actually breaking the molecules apart.
You'd be amazed, and I don't know, Carly, if this happens to you at all, during the normal course of what you do at the office. And by the way, when we talk about the office, we're talking about Vein Clinics of Hawaii. Didn't mention that often. VeinsClinicsOfHawaii.com, 4 Islands. Lots of different things going on here in the Oahu office. Carly is talking about the treatment of some of the aesthetic things. I'm going to guess that because this is elective, some procedures are quicker than others, and you can cover more ground or do more things. But when you talk about ethnicities, and I want to get back to the tattoo for a minute. What expectations are there? Because from most people say, hey, you're done. This is forever. The tattoo guy better tell you that. Aren't there now some procedures coming along that are a lot better than they were?
Definitely. I think like the most realistic expectation for patients with tattoo removal is it does take time. Mm-hmm. It's not something that you can just walk into any office and have it treated and it disappear right away. But
in a perfect world, but the world's not perfect. That's why, folks, listen. If you're thinking about a tat, you better really think about it, Doc. I think this is kind of funny. I don't know if we've discussed this before, but a friend of mine told me that if you when a kid comes home with a tattoo, it's too late to scold the kid. I mean, it's done. Yeah. So you have to know that this is a conscious decision you got to make. Are you, as a practitioner, and I'll ask Carly the same thing, are you surprised at how popular tattoos have gotten? And it is really mainstream. I mean, it's all over the place right now. But that doesn't mean it's going to stay that way.
Yeah. Well, compared to when I was growing up, tattoos are so much more socially acceptable. Yeah. And, it's rare to find somebody who doesn't have a tattoo anymore. And even fairly extensive ones. I mean, all the tattoos on the arms and stuff. And, I don't have an objection to it, or, I don't judge people because of their tattoos. Not the way that, everybody used to, that's for sure.
The reason I asked is because this came up before, and some people that have venous issues or, veins go bad, that have varicose veins that need treatment, sometimes these are where they're tattoos.
Yeah.
And so you might have to tell somebody, that diving swan that you have may not be the diving swan. It might be might be a magpie.
An old crow by the time we're
exactly.
Dead. Yeah.
So, and Carly, you said it, maybe people don't get it, and I'm sure you explained this. Doc's explained it. Your skin keeps growing. I mean, you get new skin. It's an organ. It's a live organ. But what about new veins? I mean, the veins are locked into that skin, right? The skin's disappearing or the veins disappearing.
Yeah.
It's so... So that therein must lie the challenge of explaining to somebody, especially if it's a big, huge tattoo that's like all over the place. Boy, that's a big order, huh?
Yeah. But we can treat it.
Yeah.
Yeah, I think you just have to know what the limitations of whatever it is that you're treating are with what you're treating it with. Mm-hmm. And you have to convey that to the patient, but you have to keep conveying it to the patient over and over again, because they don't want to believe what you're telling them. I know when I talk to people about spider veins, I'd say over and over and over again, well, we're going to do these injections, but it's not going to be 100%. Mm-hmm. But invariably, they come back expecting and wanting 100%.
Yeah, I must tell you that happened to me. And I am so impressed with what eventually did happen. We are in such an instant gratification society. We want stuff right now. Walk in, run out with no veins showing anymore. But, I had one that looked like a train wreck for a couple of months, and then it's gone because the doc did, exactly what it's supposed to do. So one thing that I think, Carly, is kind of important that patients must know this. How long do the treatments last? I mean, how many things can you do at one time? Is it based on per square inch? How do you come up with a program for somebody and explain to them how it's going to work, and more importantly, how it's going to what it's going to cost?
So usually with time frame, normally I just talk to the patient about what their expectation is, you know, because everyone has different expectations. Some people might have some pigment on their face that they just want to lighten up. So that is going to take very few treatments. Other patients, and they may do a really good job at protecting their skin from the sun.
I bet they sure will after. After a while,
Yeah, some of them. But then others who, you know, are a little bit more negligent on that aspect, and they also expect they have a very high order of how they want their skin to look. It's going to take more treatments. And, you know, I tell them that up front. Typically, I tell all of my patients the sweet spot is 3 treatments for most of the treatments that we offer here.
See, that's good to know.
Yeah. But there can be more. And also, you know, maintenance is important. So 6 months to a year maintenance treatments. That's normally the expectation I give to the patients. It's up to them if they want to come back or not. But the nice thing about our office is we do offer packaging to kind of model the treatment plan that we set forth. And if patients have any extra treatments left, then they can just use it for their maintenance. So that kind of, I guess, ties into the cost. And cost is very different. It's hard to pinpoint exactly. So we have to pull patients in first to take a look at what's going on.
And by the way, we're never going to do that on the radio. A lot of people want it. How come you can't say what it is? It's not that Doc or anybody is afraid to say that, but it's different for everybody. So we don't want somebody to think, well, that might cost $1,000. Maybe it's $200, or maybe it's $5,000. I mean, you never know until you really get into what the expectation is and how you can do it, right?
Yeah, well, it's very different according to what the patient wants or needs. And very different depending on what modality we're using, one from another. And you mentioned a couple hundred. Well, there are some procedures that we do that are just a couple $100. Very affordable for most people. But yeah, it's hard to discuss it specifically without actually seeing the patient and what they want.
I know these because of the building show I do, and some of our contractors when we do these home building shows, and somebody wants to know how much per square foot. Well, it's a lot less per square foot in a bedroom than it is in a kitchen and all of these things. Well, isn't it sort of the same thing?
Yeah.
Sometimes what a patient has is, for you, piece of cake. This is easy. We'll fix you right up.
Yeah.
And this is going to take a little while. Here's what's going to happen, or here's what can happen.
Definitely, yeah.
Another machine that we have gotten here just recently, which is a relatively new machine, is something called Sculpture. Sculpture. And Sculpture is a non-invasive fat reduction type laser.
Excuse me, where's my appointment book? Okay.
We can get you in real quick.
Yeah.
I've got connections. I'll tell Carly to get you in.
I'm going to call him up and say, I know the doc. Mention my name. I think he'll remember me. Okay. But seriously, I think that is a huge thing, and I wanted to talk about that because I know that has got to be one of the fun things when somebody can really change the way they look based on sculpting. Explain what it is, how it works.
Well, the Sculpture is it's a laser-based energy source. There are other modalities out there that freeze fat. I won't mention the name, but that machine's been around a little longer. We feel this one's a little better because of for a variety of reasons. But the laser machine, the Sculpture, creates a little more homogeneous type energy area, and so consequently the contouring is a little better. But this is a machine that is kind of recommended or best used on people who are not terribly obese, but have a little extra fat tissue either around their belly or on their flanks or arms, thighs.
You know who you are. I mean, all of you are listening, you know who you are. I know who I am. And I guess that's another thing that's pretty interesting. When you do a lot of, I happen to be doing a lot of camera work in my career right now, and you don't look the same. I mean, with television, it'll add weight to you, or it'll take weight off you.
Yeah.
But sometimes it says, "Hey, I saw you on the episode, and you look big." I said, "Oh, good," because that's what they wanted. But what I'm getting at here, isn't it sort of interesting what people really think about? And when you talk about this sculpting, where does it go? In other words, is it obviously it's not being sliced and diced out of me? What happens to this?
The laser energy actually kills fat cells, and
dead.
We're born with X number of fat cells in our body, and we don't produce more fat cells. However, we can pack.
I was going to say you can fill them up. Right?
You can fill the cells. But so it works by killing fat cells, and the cells just kind of deteriorate, disintegrate, and then your body kind of just filters it out of your system. But thereby creates a lack of volume, and also creates a little bit of skin tightening, so that again, people who are kind of have an again, this is best for people who are relatively fit. Are concerned about health and diet and that kind of thing, but they have a few extra pounds, a little bit more fat than what they really want in any particular area. And this is an ideal kind of procedure.
Yeah, what I'm interested in is sometimes, and Carly, I know that sometimes you don't necessarily take that and weight in the same breath. Sometimes the weight is not the issue at all. Somebody can be 30 pounds more than they're supposed to be on the chart, but they don't look it. But what they do see is that little thing hanging over their belt. So let's talk about that. And the fun that you must have sometimes when it's, wow, this really worked on this guy or this gal.
Yeah, using the sculpture, it is a little bit of a form of art, because we are sculpting their body in a way that they want it to be sculpted. So yeah, like it's pretty cool, because I think that, as opposed to some of the other therapies out there like liposuction, there's a lot of downtime. I've seen, in my experience, I've seen tummy tucks, which looks very painful, and the recovery is horrendous on that. These procedures, it's so nice because the patient comes in, they tell us what they want. Each treatment is about 20 minutes long, and they walk out. They might be a little sore, like sore muscle, but they walk out and there's essentially no downtime. And, that's important to a lot of people, especially people in Hawaii who live the lifestyle that we live. We're out, or most of us are outdoors, active, and we want to get going back with our lives.
What I'm asking here is how many people are saying, look, Carly, my 15th high school, reunion is in a month. What can we do? What can we do? What's the crash course on this? So we're once again talking about expectations that people have. And when people come to you from the different referrals, like maybe listening on the program, by the way, you can go to veinclinicsofhawaii.com, click on get an appointment, find out what you can do, when you can come down and visit and all that stuff. But obviously, the first step is the most important one. And you said earlier, and I need you to repeat that what is the practice of the practice? When somebody walks in and they're brand new, they've got a lot of questions. You're going to have to give them a lot of answers.
Definitely. So yeah, I guess with sculpture, the realistic expectation is you have to give yourself at least 12 weeks to see some.
Remember that you have the big reunions coming up in August of September. You start right now.
Yeah. So our patients do see results in roughly 6 weeks, but optimal results are achieved at the 12-week mark. So we do have patients that, they come in for their consultation. We discuss what areas we're going to treat and, kind of give them a package of what they need to do. And then when they come back for their treatment, they are expected to return in a month, or return for their first treatment and then return a month thereafter for their second treatment. So this is always going to take 2 treatments, which is kind of nice because we can deliver a realistic expectation on how many times they're going to at least need to come into our office versus the other lasers that we have. It's kind of touch and go, see how it goes, So yeah, it's, I guess,
what I was getting at is this. Let's say that you've made the decision to do this, and you come in and you get your treatment and you get your ongoing. I'm guessing, Doc, that some people will want to say, I got to change my lifestyle because I just invested a lot of money in this body and I don't want this stuff coming back. So when you said earlier that, you have a finite number of fat cells, and if in some of the liposuction, if you remove them, now you have less fat cells. That must mean they're easier to fill up.
Are they easier to fill? I don't know, but yeah, we're directing, I think, this therapy to a specific personality.
Sure.
Somebody who really is interested in maintaining good health, and it's so important for the patient not to come in, have the sculpture. Or any other, lipo and that kind of thing, for them to continue a healthy diet and lifestyle. Otherwise, it's wasted.
Yeah, and I knew this from the very beginning. And one of the things I was wanting to do was talk about the fun side of things, because people can get sculpted, they can get wrinkles removed, they can treat scars, they can do all of this kind of stuff. But let's talk about when it's change of lifetime, and let's talk about divorcees, and let's talk about people that are, for one reason or another, getting back into the swing of things, and they're not happy with where they've let themselves go over the last 20 years, so they come in with a big shopping list. Let's sit down and say, okay, I want to plan this out because I'm going to get back in the dating game here pretty soon. What can you do for me?
So I think
men and women.
We can do everything.
Yeah. The answer is come on in. If you've found the right place. Yeah.
Yeah, I think the one important thing is the like as Dr. Juleff has mentioned a couple times, the first place that it starts is developing a healthy lifestyle. So if a patient comes into our office obese and not really active, then that's where they need to start, And we tell patients that we're not going to sell a product to a patient that they're not going to get good results
Yeah, good
from.
for you. And what I like is another thing. And before we run out of time on this episode of the program, I want to make sure you understand something. Dr. Juleff's staff keeps fastidious records of all of the vein stuff you have. There's charts, there's ultrasounds, there's all of this kind of stuff. You must do the same thing for an aesthetics patient, is build up a history, a good dossier on them, so you can keep an eye on them, and so that they can maintain their goal, but also see the relevance of changing their lifestyle a little bit.
Oh, definitely. For this practice, especially the aesthetic practice, it's important to take before and after photos. I have had patients
I love that.
who I've already treated who, I show them their first picture and their most recent picture, and there are things that changed about them that they didn't even expect or necessarily want, but they love. And to see that change and to see the patient's reaction with that change is really rewarding. So
I guess that, we need to make people, it's not a leap of faith. I do know already that a lot of people come to your office for what you do, the venous surgery, for varicose veins and all these issues. But once they're there and they see other patients that are in there for, a little this or a little that, it's like, hey, wait a minute, I'm missing the boat here. I want to do more stuff. So let's make sure that people understand why you decided to offer these different treatments and procedures to people, because they're coming to you for good self-esteem and good results. You might as well give them more.
Well, and that's exactly it. We for many, many years we did primarily vein care, and like I said before, a big part of vein care is not only treating the underlying medical problem, but treating the superficial problems too. And just about everybody who comes into our office with vein issues, they're concerned about how their legs look.
Sure.
That's a natural part of it. And for me, it's sort of like finishing the job, making it look good. Not only do we want to get their legs functioning well, but also we want them to look good.
Yeah, I feel pretty good, but I don't look so good. Let's make me look good now.
Yeah. So, as a step then beyond that, that's why we kind of decided to include other aesthetic type things. Yeah. And, facial rejuvenation, taking care of, sun damage to the skin, doing hair removal, and now doing the sculpture. It's kind of come together nicely.
Okay, now you have your expectation. You go to veinclinicsofhawaii.com, veinclinicsofhawaii.com, and you say, I was listening to Carly, and I think I want to talk to Carly about some neat stuff. You're waiting for him, aren't you?
I am.
Hey, thanks for listening. We'll be back again next time. In the meantime, go to veinclinicsofhawaii.com, www.veinclinicsofhawaii.com, and go get yourself feeling better and looking better. I did, and you should too.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.